class. My name is Kelsey Smith, and I will be doing my video over obviously the heart, and then a type of congestive heart failure, or CHF. The type that I'm going to be doing today is called left-sided heart failure. But first, before I get into that, I'm going to go ahead and talk to you guys about the different parts of the heart that I have here. So we'll go ahead and start at the top. Up here, we have our superior vena cava, and then down below that, we have our right atrium, and then down below that, we have the right ventricle, and then here is your inferior vena cava, or IVC. And then up here, next to the superior vena cava, we have our aorta, and next to that, we have our pulmonary artery, and then here is our left side, and we're talking about our left atrium, and then your left ventricle, and then down here is actually your myocardium, kind of the muscle part of your heart there. So I'm gonna show you a closer picture here of the heart, just so you can see what I have here and see what I was talking about. And then I'm gonna go ahead and get into the left-sided heart failure and talk more about that. So left-sided heart failure is when the heart loses its ability to pump the blood correctly throughout your heart. It causes hypoxia throughout your body, which is where your body's not getting enough oxygen needed for it to work correctly. So as a result of that, you may get cyanosis, like bluing of your lips or your fingers, which is due to the hypoxia that is going throughout your body. So to talk more about this, not only is there left-sided heart failure, but also right-sided heart failure. But I'm going to be talking about the symptoms and treatments and prognosis of left-sided heart failure. So with left-sided heart failure, there are several symptoms that may present with. You have fatigue, confusion, restlessness, wheezing and rales upon auscultation. You may have fluid overload in your body. You may have coughing. You may be super tired. There's several symptoms and signs that go along with left-sided heart failure. Now, for treatment-wise, there are a few different medications that doctors may prescribe to a patient that has left-sided heart failure. One being diuretics such as Lasix. They are used to lower the fluid content in the body to kind of prevent the fluid buildup in the lungs, as well as swelling of the extremities. And then we also have our ACE inhibitors, which can be used to help open up those blood vessels and help the blood flow more freely throughout the heart as well as the body. And then we also have beta blockers, which help keep our blood pressure from becoming too high, and also help lower the heart rate as well. So with left-sided heart failure, it can be diastolic or systolic, which means the heart is either struggling to contract correctly, or it's also could be struggling to relax correctly as well. And then there are, and then you also have your prognosis, which is going to be patients who, usually patients who are diagnosed about after 5 years or so. About 50 to 60% of those patients are, it's going to be fatal for them. So, but that's all about left-sided heart failure.